Doctors on the front line have slammed the lack of personal protective equipment available, but the Victorian government maintains there is enough for everyone. Now Today has uncovered healthcare workers have been relying on a Buddhist charity to supply significant amounts of PPE for months. Christine Ahern has been relentless in her pursuit of the truth in this crisis and filed this exclusive report.
These are deliveries of much-needed masks, gowns and face shields to hospitals and aged care homes around Melbourne. But it's not coming from the government, rather a Buddhist charity called Tzu Chi.
The lady out at Northern Health, when we turned up with most probably 20 boxes worth of face masks and everything else, she was so emotional she was actually nearly in tears.
They've delivered over 41,000 masks, 1,300 gowns and almost 400 face shields to our frontline workers since April 1. Doctors contacting them throughout the pandemic to ask for help and continue to do so.
Yes, they're still in need of it. So what we're going to do is try to make further contact and through our contact to see whether they need more and how we're going to actually deliver to them.
The donations come from the charity's members and also the public. The face shields they make themselves. Sources telling the Today Show that at least one aged care home wouldn't have had enough supplies without them.
We just keep trying to find as many organisations that we can that are out there on the front line dealing with people so we can just make sure that they're safe.
Over the past 2 weeks, the number of Victorian healthcare workers infected with COVID-19 has more than doubled to well over 1,000. The Victorian government has always maintained that there is enough PPE for all healthcare workers in the state. In fact, the Victorian government says it acted early to protect our heroes. In a government warehouse, there are 68 million gloves, 19 million masks and 2 million face shields. Which begs the question, why aren't the supplies getting to where they're needed?
I'm certainly not aware of anything other than the timely delivery of what's needed.
Anna is an aged care worker. She also has COVID-19. She doesn't want to be identified. Despite deadly outbreaks in other facilities, the PPE required where she works just a week ago was the bare minimum.
Last week, no, I wasn't. I was wearing the mask, the little blue mask, and that was it.
So at the aged care home, you were just required to wear a mask. You weren't required to wear anything else?
No, because we thought, we have no one, sort of thing. We have no one that's tested positive.
But she found out from colleagues that some residents had tested positive. Concerned, Anna, who still doesn't have any symptoms, took it upon herself to get tested and self-isolate. She returned a positive result.
She told me that she only was required to wear just a mask as of last week.
Well, that's when I started thinking about it and thought, well, if they had had the full PPE with everything that was going on, maybe this wouldn't happen and we wouldn't be in this situation.
All aged care workers in Victoria are now required to wear face masks and shields, something which is meant to be provided by the federal government. But Anna is speaking out, wanting testing and PPE regimes tightened to protect the elderly, especially for those that may be asymptomatic like her, unwittingly spreading the virus to our most vulnerable.
That's what makes me mad and upset. I could have given it to someone so vulnerable and not knowing about it. I love every single one of my residents. I treat them like my grandpa or my grandma. And knowing that they're sick and they're in hospital and they're scared makes me so upset,
Gee whiz, that's disturbing, isn't it? They're crying out. Christine joins us now. Chris, why is the PPE not getting through?
Well, Karl, that's the big question. It was only 2 days ago that former AMA president and frontline worker Mukesh Haikerwal made a really impassioned plea here on this program for more PPE, describing the situation as dire. But then there seems to be a blame game between the state government and federal government about who is responsible for what area. Caught in the middle, of course, is our frustrated frontline workers. But it's not just claims anymore, because we are showing you actual vision of tens of thousands of masks and other supplies actually being delivered to hospitals and aged care facilities by this charity. I must say that this Buddhist charity is above all those politics. It is an amazing organisation and simply doing its best. But I think most Victorians would be really surprised that at the height of this pandemic, Buddhist charities are stepping in to plug holes in our PPE supplies. Karl.
Well, thank goodness for them. Christine Ahern, thank you.